Dr. Ram's Medical Coding Academy is the final destination to hone your skills. Training is imparted by the All India topper of AAPC, who is Certified Compliance Officer and Medical Auditor and past speaker of Chennai chapter.
Hi guys, welcome to Dr. Ram's Medical Coding Academy's free session on medical coding. Today we are gonna see about the CPC examination pattern and how this exam takes place. So I'm going to share the insights about this exam and make you get prepared for this examination. So as you know, this is a certification exam which is of international reputation. So once you clear this exam, you can travel to any country and you can call yourself as a certified coder. In fact, your visa processing can also take place very easily with the acquisition of this credential, as medical coding is not just a job which is limited or restricted to one particular country. It is an international job, as it is associated with the insurance sector of the healthcare. So let's turn over a new leaf and we will see what this CPC examination is all about. As we discussed in our prior video, this examination is being offered by this American Academy of Professional Coders. So what is the eligibility to take up this exam? So per the AAPC, you need to have at least 2 years of experience with medical coding. And AAPC strongly recommends that you be a graduate. Here you can understand that it is only a recommendation, but it is not made mandatory. But what happens in India, our level of education is a bit high, and so we expect a future aspirant of medical coder to at least be a graduate. Preferably, if you are from a science or from a medical or from a life science sector, then you are very much welcome to join this profession. Coming to this age limit, so this is one thing which I was being questioned by so many times by many of our students, and of course by many women and doctors and nurses and people from all sorts of professions. Here you should understand the age limit for this. Actually, there is no age limit to take up this exam. But what happens, take for instance in Chennai. Now Chennai has become a kind of a metropolitan city. So here you find people flocking from various states, like people from Mumbai, Madhya Pradesh or Kerala or even Telangana or Andhra Pradesh. They also flock. So what happens, there is already a demand because there is too much of population. Doctors and healthcare professionals are also jumping to this profession. So what happens is we have created or set a benchmark. So where you need to be a graduate and you should be like less than 30 years of age, because some companies might have their HR policies as not to hire or recruit coders who have crossed more than 30. Frankly speaking, there is no such clear-cut age limit or restriction, but you can always check with your companies if they have any such age-related policies in their company, because you take up this examination or you take up this certificate training, and finally if it's not going to fetch you a job, then that's going to be useless. If you are going to be there in a kind of a remote or in a kind of a rural areas, and if you have any such medical billing companies or RCM companies, you are always welcome to reach out those companies and inquire first if age would be your limitation. Next, coming to the CPCA apprentice, this is actually the certificate that will be provided by AAPC, provided if you don't have this 2 years of experience. Say if you are a fresher, maybe you have completed this coding training, this entry-level training, and then if you are taking up this examination within 1 year of joining this coding industry, then you will be provided with this apprenticeship certificate, because AAPC recommends to have you like 2 years of experience before you take up this examination. So what to bring on the day of exam? This is very important. What are the documents that you need to bring? So you will be given a hall ticket which will be sent to your registered email ID at least a week before the start of the exam. So make sure that you take a printout of this hall ticket, and then you are supposed to bring 2 original government ID cards this is very important. One should have a photocopy of your own self because there are chances of misrepresentation. So APC expects that one should have your photocopy and other should have your address. So make sure that, what happened was, one of my students actually, he has taken his driving license, and in India what happens is we can have a photocopy of our driving license in the exact form of this original. But what happened was, he had his colored xerox of his driving license, but then he was forbidden to take up this exam. He was not allowed to take up the exam because he did not bring the original government proof. And there were also instances where coders would call at that time their family members to bring those exams. So that all depends on the proctors as well. So there are high possibilities. So I suggest that you have at least 3, so that if one government proof is not working, you can show the other proof. And there was also one particular incident where another student who happened to take up her examination in Hyderabad. Now there she was asked to link this, mobile number and this your Aadhaar card, and your OTP would be sent, and only then you are allowed. So things are really getting stringent, and that depends on the sites as well. So it is always expedient that you prepared for all of these. Next is, you need to take up the coding manual. Since it is an open book exam, you have to take up the ICD 10CM, the CPT and the HCPC's manual. Here you should understand this. There could be, like say in Chennai, where for the exams where I wrote, most of the examinations they provided us the manuals. So all these books were given by the centers where we are writing, but this may not take place in all the centers. But if you took in Cochin, I remember one of my students took in Cochin, where he was asked to bring this manuals. And here again, you should bring only the original books and not the Xerox copies. And the another thing is, even if you bring the original book, ensure that you do not write too much in the book, because the proctors or the supervisors have the right to refuse to permit you for the examination if you have written too much of content in your CPT or the ICD-10 books. So you have to inquire whether you will have to bring your books your own self, or it will be provided by the examination center staff itself. You should have pencils, erasers and sharpeners, and you are not allowed to write using the pen. Ball pen pens or any fountain pens are not allowed, so you can very well have with your pencils. Next, take as much of water bottles, snacks and chocolates with you, because you are going to take up an examination which is going to be for 5 hours 40 minutes, and 1 hour you will have to stay there within the examination room, so 6 hours 40 minutes, and apart from that you will have to stay for at least 1 hour outside, where you will be checked and you will be monitored. You will be checked for your hall tickets, your books, your documents verification and all that stuff. Plus, you are not allowed to have your mobile phones or any electronic devices. You will have to keep them all outside, and you will be provided a token for all the things that you surrender to the exam center staff. Let's see this exam features. So how this exam takes place. So as said earlier, it is a 5 hour 40 minutes exam where it is an open book exam. And then the number of questions that you are going to attempt would be like 150, of which you will have to select, or you will have to get correct answer for 105 questions. And the minimum pass percentage for the examination is 70%. I have seen coders who have got like 69.03 or so and so in decimals, and finally they failed. So you will have to take up the retest again. So ensure that you should have 105 questions correct in order to clear this particular examination. And this exam is going to be of objective multiple type. So where there will be 4 options being given. Some exams, say like the medical billing examination, which is CPB, might have like 200 questions. But the majority of these exams and even the CPC would be only of like 150 questions. So there will be like 4 options, and among these 4, you will have to select the one. It all depends. So among the 4 options, you will have to select the correct option. Coming to this exam syllabus, So how are you going to be tested and what is the syllabus? This is pretty obvious. What happens is it is the evaluation and management. So that has fetches like 10 marks, and then anesthesia will have like 8 marks. So how you can remember is ESRPM. EASRPM. E for evaluation and management, A for anesthesia, S for surgery, R for radiology, P for pathology, M for medicine. ESRPM. So when you go to anesthesia, 8 questions will be, or 8 marks will be asked from that. And next comes surgery. Under surgery, you have like 60 questions. So surgery occupies the highest section, or the section with the highest number of marks. So with surgery, we are going to have questions from the integumentary system, and then from the musculoskeletal system, the respiratory system, the cardiovascular system, the gastrointestinal and the urinary, the reproductive system, and the nervous system, and the special senses, which is the auditory and the optic system. So accordingly, we have like 60 marks being distributed for all these organ systems or the chapters. Then comes radiology, where you will be tested on this imaging techniques, imaging modalities like CT, MRI, X-rays, or any other radiologic imaging techniques, and lab and pathology. Laboratory and pathology services fetches you like 10 marks, and the medicine section fetches you like 10 marks. Questions will be asked from this ICD 10CM. Regarding this, you will have to select the ICD 10 codes or the guidelines. Next, we also have this coding guidelines. You will be tested on this, coding conventions, or say like diabetes and hypertension and reporting of poisoning and adverse effects. And then anatomy and medical terminology will carry 8 marks each. So you have anatomy 8 marks and medical terminology 8 marks, and HIPEX will fetch you like 5 marks, and medical billing, compliance and regulatory guidelines will fetch you like another 5 marks. Now on the day of exam, so you should know where your exact site or the venue of the examination is. I strongly recommend you to visit the exam site at least 1 day or 2 days prior, because you cannot be looking out for the site or looking out for the venue on the day of examination. It might make you anxious or even panic. So better be prepared, or if you know someone, your neighbors, your friends or relatives who can spot the location, that would be absolutely fine. So locate the examination and try to arrive at least 1.5 hours prior, because you will be checked for the books and the documents, and then you will have to stand up in a queue where you will be called out, and then you can go and take your seat. Sometimes you will be given a specific seat, you will be allocated a specific place to be seated, or sometimes you can have a random seat. That depends on the examination center. Please ensure that the entire examination is under a CCTV surveillance or under CCTV monitoring. And you have like proctors, so who act as supervisors. There would be at least like 2 proctors, or sometimes you can have like one proctor, and who would also be assisted by so many other staff, where the proctors will tell you what to do and what not to do. So they will read out all the instructions. Now coming to this instruction, so once you reach this exam center, and then you are asked to enter this examination hall and where you are seated, at that time the proctor will just read out, after all the seating and after all you settle, the proctor will just read out the rules and regulations of the examination, what you are supposed to do and what you are not supposed to do. Okay, so what happens is you will be given an OMR sheet. There will be a polythene cover, and within that polythene cover you will be having the CPC exam booklet and then an OMR sheet, which is optical marking reading. So what happens is you will have to fill all your personal details, your name and then your address, your membership ID, the index number, and then the version of the exam and the exam type. All that you will have to manually write with a pencil, so that even if you make any mistakes, you can erase it and you can rewrite with your pencil again, and then you will have to shade the boxes accordingly. The hall ticket contains the index number of the exam. So all the people who are taking this particular exam on this particular date at this particular venue will be given an index number. And make sure you also remember your AAPC membership ID, because if you know this by heart, it is easier, because you also need to include that information in the OMR sheet, and then you have to share that as well. And if you have any comments, you can also write down at the end of this OMR sheet, how was the exam being conducted and all that. You can write your comments and you need to sign as well. They might ask you whether you took any certification course prior, or what is the total number of years that you have. Did you take up any other training course from AAPC, or do you have any such anatomy prep course, anything like that. So you will have to enter all that information within that OMR sheet itself. So after the instructions are given, so do not worry, the instructions are like separate. So this time will not be counted in your exam time, because your exam time will definitely include that 5 hours and 40 minutes. So other than all the instructions are over, now the exam would be about to start. So prior to the start of this exam, now what happens is the proctor would be calling out your name, and you will have to go and collect your booklet. So there could be like at the max like 150 or 100 coders who are appearing for the exams, and not all will be writing the same examination. Please understand, one might write this medical billing certification, or the other coder might be appearing for medical auditing, or one might take a specialty credential like gynecology. So it all depends. You do not know what they are appearing for. So all these people would be writing the exam in that particular venue, in that particular exam hall itself. And another thing is like, you might receive different versions of the booklet. So you cannot assume like whether your friend is also receiving the same booklet. It could not be like that. Maybe the version could be different, where the order of questions might be different. Okay, so all these need to be taken into consideration, and each of you will be given a booklet. So this would be there in a polythene sheet along with the OMR sheet. So this polythene sheet will contain a small sticker that contains your name and your membership ID. Plus the index number will also be printed on that slip of paper. The index number will also be there in your hall ticket. So don't worry, you don't have to memorize that. And that index number would start with AAPCE followed by numbers and your membership ID. So within that polythene sheet, you will have to, once the proctor tells you to open the polythene sheet, then you can open it up. Please understand, you are not supposed to open the booklet. You will have to open only the polythene sheet and then take away the booklet and the OMR sheet, and there is one more thing which is called as a golden seal. All these three items will be kept within the polythene sheet. Just take the polythene sheet, keep it aside, because on the display of the polythene sheet you will have your name plus your index number plus your membership ID. If you don't remember your membership ID or the index number, don't worry, it will be there within your hall ticket also, so you can keep it aside. Then keep the booklet aside and the OMR sheet and the golden seal. Now this golden seal is something, what happens is, after you complete the exam, you will have to close the booklet with these golden seal, and then you will have to return it back to the proctor. So you understood. So what you should do is like keep the OMR, because it is a OMR that you are going to shade and input all the details. You are going to write with pencil all the details, your state, your address, your communication, your contact number, the proctor's name also you will have to write down. So all that you can write it in the OMR sheet and fill it up, and then you have this booklet. So once the proctor tells you to start the exam, only then you are supposed to open the booklet. So do not open unless a proctor instructs you to open the booklet. So what happens is, this booklet will be stuck with 3 silver foils, so silver wrappers. So you can take with your pencil. With your pencil you can remove those silver wrapping, and then you can open your booklet. So this should take place only when the proctor instructs. Otherwise, do not do it. Keep your golden seal safe, because after the exam is over, you will have to close the booklet with the golden seal. Once the instructor or the proctor prompts you, open the booklet and see here. So maybe the first question would go for like pages, could be like for 2 pages. So do not panic. So what you do is like just turn over the page and start attempting the easy questions first. Okay, so here what you should do is like, and you should also understand, keep the track of the questions that you are attending. Say you might be starting from the 12th question. So, but you should also shade only the 12th question in the OMR number, that is 12 given in the OMR sheet. Okay, so do not panic. So whatever you are going to attempt, keep in mind, keep reciting the question number so that you share the exact option of that particular question. Say if you are going to start with 12, then you should shade only the boxes which are given under the 12. Okay, so what you do, start with the easy questions. Start attempting the easier ones, because once you start attempting them, you will get a kind of a confidence, and the more the number of questions that you attempt during the initial hours, that will certainly influence your pass percentage. Because what happens is, majority of students complain that they are not able to complete the exam on time. Okay, because what happens, roughly you have like 2 to 2.5 minutes for every question. That's a maximum time. So you cannot dwell much longer on a particular question, because maybe it could be a lengthy surgery. It might be there for at least 1.5 pages or even 2 pages. So it is not possible for you to read this 1.5 or 2 pages of the surgery and then look at the options and then look at the codes in your manual. It is not possible. So you will really have to save your time on the easier ones. That's why the real mantra is, attempt the easy ones first. Say if you're a coder who's been working with one particular specialty for a year or so, you can start attempting the questions from that section first. If you're a radiology coder, you can start opting this radiology first. If you're a pathology coder, you can start attempt the questions on pathology. So it goes with the personal experience of the coder. And there won't be any extra papers or any other materials will be given for you to do your calculations or any rough work. So everything is within that booklet itself. And I'll tell you, this booklet also will have spaces, will have enough space for you to make any calculations, or if you want to write anything, so that if you want to understand certain things, while selecting the codes, everything can be written in that booklet itself. So you don't have to worry. Enough spaces are also there. Extra papers will not be given to you. And another importantly, the restroom breaks are all included in that time. So once the time starts ticking, so from that time your time starts. If they're starting at 10 o'clock, it will be like 5 hours 40 minutes from 10. If they're starting by 10:30, it will be 5 hours 40 minutes from that time. So all your restroom breaks are also included in that. Okay. And another thing which coder does as a mistake, I tell you, is, see, you are going to take up this exam for such a lengthy hour, right? So what happens is, naturally you become exhausted, because you need to think. For thinking, you need glucose, you need energy, right? So what I suggest is, when you are going to attempt the difficult questions, you start taking the chocolates or the snacks that you have brought, because you become really dehydrated if you don't drink, and you will not have the energy to attempt the questions, because you'll have to think a lot. So don't think it is a waste of time. Take as much as food if you want. If you feel that if you have a good sugar level intake, what happens, naturally your brain can work faster, because it is getting the energy. So the end of the exam is, so when the exam comes to an end is when again the proctor tells you to stop the exam. Once the proctor tells you to stop it, you will have to stop everything, and do not again read the questions. Don't panic or don't become anxious. You will have to stop it. Then what happens is, at that time, more importantly, you will have to keep the OMR sheet separate from the booklet. You are not supposed to keep the OMR sheet within that booklet. Keep the OMR sheet separately, and then you will have to close your booklet, and you remember that golden seal. So now remove those wrappers from that golden seal, and you start sticking to the edges of the book, and you will have to give the booklet separately and the OMR sheet separately. You can put all your coding books there. If you have brought them, you can very well take them. The stationery items like sharpeners and erasers, if they are provided by the staff, then you will have to leave all of them there, and then you can very well leave the examination hall. So what happens after the exam is over? You can leave the hall, and then you will have to wait for at least like 1 week or 10 days. That depends. You don't have to contact AAPC. So your result will be published within your AAPC login ID, your website itself. So you can log in and you can see for your results. Otherwise, sometimes you might also get an email notification from the AAPC about the results. So there, if you find, when you go log into your website, you can find the section wise allotment that is been given to you. How many marks you took in surgery, how many you took in anesthesia, how many you took in pathology. It will be a section wise breakdown of these marks so that you can understand where you actually scored high marks and where you scored less. And in case if you did not clear the examination, do not worry. There is again a next option that is there where you can retake the exam. So at that place itself where they are publishing a result, in case if it is a negative result like fail, so what you can do is like you can retake the exam. So please understand, do not retake the exam unless you are fully prepared. Go through this section wise breakdown of marks and see which are your weak areas. Try to improve, take up more tests, revise the previous papers. If you are associated with any training institute, take the mock papers as much as you can, and only when you are confident you can book the exam again. Please do not do it in a hurry stating no, I will have to finish up within the short time, and if you fail the second time also, that's it, the money is lost. You will have to again pay this 40,000 and you will have to reappear for the examination. So it is always prudent that you prepare well and then retake the exam the second time. Coming to the secrets of cracking this exam, here you should understand the first thing that I can tell you is get trained from Dr. Ram's Academy, because we really provide you with that kind of insights and understanding. The real secret of cracking this exam is get trained from the right people. So I would strongly recommend to get the CPC training and the medical auditing training from Dr. Ram's Academy, because our motto is not just in clearing the exams, but you will certainly come up with colors. You can confidently call yourself as a certified or a knowledge coder once you take up the training from our academy. So next is the hallmark of this exam is about time management and presence of mind. Though the exam runs for 5 hours and 40 minutes, and though you are going to be there in the exam hall for 7 hours, close to 7 hours, so it's not just the what matters is your time management. Because as said earlier, it's just 2 to 2.5 minutes that is being provided for every question. You might have lengthy surgeries, so it is not possible for you to finish, right? So what matters is your time management. Start attempting the easier ones first and then you attempt the difficult ones. Especially I tell my coders to attempt the cardiovascular section of the surgery as a last, because those questions usually would be more lengthy and sometimes difficult. Another secret is where you'll have to do it by the elimination method. You have to eliminate the unwanted options and then you can narrow down your choice. So this elimination strategy will be definitely taught to you during our training. And as I said earlier, it's not that you will have to clear all the questions. It's you still can go wrong. 45 questions can be erroneous and you can still pass the exam, because 70% is what is needed for passing this examination. Apart from these, there are other strategies which will be imparted once you become a student of Dr. Ram's Academy. Okay, so you become a certified coder, you have got your results, you have cleared the exams in flying colors. Now what happens? So once you become a certified coder, what you have to do is you will have to fulfill your CEUs, which is your continuing education units. And these units can be easily cleared by taking the tests that are being offered by this AAPC magazines. So monthly tests will be provided. You will have to appear for those tests and you can fulfill the CEUs. Plus you can also attend the local chapter events where you will also be given the CEUs, which is a continuing education units. So most importantly, you will have to maintain your membership and you will have to maintain your CEUs as well. For membership, again, you will have to pay annually. Here comes a question, who will pay it? So what happens is, many companies in Chennai, they actually pay for their employees' membership. There are some companies who might put you into a contract or agreement where they'll pay you your membership fees and you will have to work for a particular point of time. And again, there are again smaller companies who cannot offer or sponsor for the membership, and in that case only the coders will have to shell out from their own pocket for renewing their membership. So the annual membership has to be done every year, whereas a continuing education units will have to be submitted every 2 years. Okay, that varies. That date might not be the same as that of membership, because you are going to submit your CUs only after like 2 years, whereas membership will have to be renewed every year. And as said, you can attend the local chapter meetings and webinars so that you can fulfill your CUs. And again, it's a kind of a request that I want the coders to beware once you become certified, because there are like fake institutes who actually do like unscrupulous things and unscrupulous activities, where they will tell you we can book the exam at a lower cost and your membership can be at a lower cost. You need to be very careful. What they do is like they tell you you don't have to pay this much money, you can pay only this lesser amount, we will get your membership and exam. No, because what happens is your membership should be for an annual membership. But what happens, those institutes might give you like 3 months or 2 months, and what happens is you will be out of your membership after 2 months. Now when you contact those institutes, they would tell you no, we will process, don't worry, everything will be perfect. But finally what happens, your membership will expire, and if your membership expires, your CPC certification will also expire. There are numerous incidents where even our own students were being cheated, were being misled by such unscrupulous organizations and institutes, and where I had to write to the chapter officers and of course to the AAPC to look into those unethical activities. So I would always recommend you to fulfill all your membership and your CU requirements from your own end itself, because you can pay everything from your own end and you don't have to rely on any other training institutes or any other institutes who claim to be like associates or partners of AAPC. If they are real partners of AAPC, then AAPC can very well publish in their website that these institutes are our partners. So you need to be really aware of these activities that happen in our community. Now what happens if you don't have this 2 years of experience? You will get a certificate with CPC-A, which is the apprenticeship. So what to do once you get this CPC-A? Now you can also get this A removed, provided what happens is you need to submit 2 letters. If you have completed this minimum 2 years of experience as medical coder, you can have this letter of recommendation from your employer's letterpad. They will have to tell you. And if you want to remove this A from your CPC, there is also a template that is available in the AAPC website itself. You can go there and you can download the template, and you can ask your employer to type in the same format as given in this template. Plus, there is also one more recommendation letter from your colleague. They should also mention that you are associated with this colleague and you have experience with working in these many specialties, and that you have fulfilled those 2 years requirement for removing that A designation from CPC. Or if that is not the case, AAPC offers another way where you need to undergo like at least 80 hours of the coding course, and at least you should have a letter from your employer as well. If that is there, your A can be removed from the CPC. Now once you clear the CPC, what next? So very simple, take up the next certification. So though it is exorbitant, I tell you, it is actually very rewarding. The more and more exams that you take up, your career will be rewarding. So it will take you definitely to various heights. So take up for the next higher specialty credential. If you are working in a particular specialty like orthopedics, you can very well take orthopedics. If you are working with ENT, you can take up ENT exam. So other than these coding specialties, you can also work with the other arenas of medical healthcare like medical billing. You can also take up medical billing or take up this practice management, and documentation experts are very much needed. If a billing company has documentation experts, that really impresses your clients, because you have this ability and agility, that capability to provide education to the doctors about the documentation perspectives, which is a huge pitfall in the practice side. You can also become a compliance professional where you can grow to a level of a compliance officer, and tomorrow if a practice is being caught, so compliance officers play a pivotal role where they become leaders and they act as a bridge between the practice and the auditing agencies. Plus, you can also take up the practice management certification as well, and you can broaden the scope of your career. Finally, once you become a certified coder, you need to know your ethics and obligations. Okay, so AAPC has listed the ethics of a coder. So just go through what are your ethics and what are the activities that you can do, plus what are your liabilities and what are your responsibilities. You should not involve in any other kind of deviant or fraudulent activities, and you should always uphold the integrity of the US laws like HIPAA, maintaining patient information, and the compliance guidelines. And again, being a certified member, you also have a risk. You should not get associated with unscrupulous or fraudulent activities, because what happens is the medical billing companies that operate here do not employ certified coders. So what they do is like they get a payment for the collections that they're getting for the doctors. So their motto is only with collections, but you need to ensure that the collections you get is on fair and legal means. So being certified, you can educate your company, your staff, or your people in your organization so that you ask them to follow the upright way. Otherwise, you will have to notify the agencies of such gross violations. So this session would have given you a fair idea on what the CPC exam is all about, because having been to the examination hall for so many times, I think this was my personal experience as all I went through, and I really wanted to share all this information to you all. Hope this session would have helped you in a bigger way. Thank you very much, and we will see you in our next class.
Dr. Ram's Medical Coding Academy is the final destination to hone your skills. Training is imparted by the All India topper of AAPC, who is Certified Compliance Officer and Medical Auditor and past speaker of Chennai chapter, for basic medical coding training and for certification exams like CPC, CCS, CPMA, CIC. Learn medical coding from Dr. Ram's Medical Coding Academy. You can contact us at 805 60 855 96 9962 791072. Thanks for watching. Please watch, like and subscribe our YouTube channel.